Here is your question. Right, so if you have read and understood, considering it's surgical and autonomous patient, kindly tell me if you can identify what are you looking at? What is this image A and B?
Yeah, this is the right, sorry, ma'am, left foot. A is the lateral, A is the medial aspect, and B is the lateral aspect.
Okay, if you can tell me what are you looking, if we are coming to image A, what is this 9 pointing at?
9 pointing at the opposite side, that is lateral tubercle of talus.
Very good. Okay, if you can identify 13.
13 is the medial surface of calcaneus.
Okay, good. If you can identify number 16.
Number 16 is the neck of talus.
Okay, can
Neck
you
of talus.
please, yes, can you please identify number 4? It's 4 is here.
Head of the talus.
Yes, very good. Right, if you can identify 21, please.
Tuberosity of navicular bone.
Okay, can you please identify number 2 over here?
Number 2 is the cuboid.
Okay, right. Can you, if you can move on to image B, and if you can identify 19 over here.
19 is the talus sinus.
Very good. Right, if you can identify 20 over here.
20 is the tuberosity of fifth metatarsal.
Base of the fifth. Okay. Right, good. If you can identify number 10.
Number 10 is the medial cuneiform.
Okay, now after identification of the bones of the foot, can you please tell me how many arches there are in the foot?
There are medial arch, lateral arch, and transverse arch.
3 arches, okay. Can you please
3
tell me the
arches.
components of the medial longitudinal arch?
Medial longitudinal arch, there are ligaments and muscles contributing to the formation and bones. The bones contributing to medial arch is the calcaneus navicular bone, um, medial cuneiform, and medial 3 metatarsal bone. And lateral arches, the bony contribution from calcaneus, cuboid, and lateral 2 metatarsal bone. Medial arch is supported by ligaments and muscles. Ligaments including ligaments including interosseous ligament, plantar aponeurosis, long plantar ligament, and spring ligament. And lateral arch is, in case of lateral arch, ligaments supporting lateral arch includes interosseous ligament, plantar aponeurosis, short plantar ligament. These are the ligaments. And in case of medial arch muscles, includes tibialis anterior and posterior, along with contribution from flexor hallucis and flexor digitorum, with short muscle of
All right.
great toe.
Moving on, if you can look at image C, D, and E, and in image C, if you can identify number 6, please.
Number 6 is the deltoid ligament.
18, please.
18 is the spring ligament, calcaneonavicular
26,
ligament.
please.
26 tuber seat of navicular bone.
Moving on to image D, if you can identify number 1.
1 is the cervical ligament.
3, please.
Number 3 is the calcaneofibular ligament.
Okay, moving on to image E, if you can identify number 3 again. Is it the same as, okay, 19?
19 is the posterior talofibular ligament.
Can you please tell me the attachments of the deltoid ligament?
Deltoid ligaments have 4 components: anterior talocalcaneal, posterior talocalcaneal, talonavicular, and
Are you sure
cuboid.
you're telling me the right attachment of the deltoid ligament? Superiorly, is it attached to where? And
Superiorly attached to the medial malleolus.
Yes,
and inferiorly attached
to
with
5
the
places.
5 structures: calcaneus, neck of the talus, spring ligament, and navicular bone.
And the body of talus as well, 5 places. Okay, what are
Body
the
of the
movements which are present at the subtalar joint?
Movements are inversion and inversion.
Okay, can you tell me what you understand by the mid-tarsal joint of your part?
Mid-tarsal joint includes the calcaneotalo-navicular joint and the calcaneo-cuboid joint.
Okay, can you please tell me what are the muscles what are the bones which form the ankle joint?
Bones contributing to ankle joint are this ankle joint is formed by articulation of the lower end of tibia fibula and the upper surface of talus.
And what type of joint is ankle joint?
This is hinge joint. Hinge
yes,
joint.
Hinge type of synovial joint. Okay.
Synovial
Can
joint.
you please explain why ankle joint is most stable in dorsiflexion position?
Because of dorsiflexion, the more wider anterior surface of the trochlea comes in contact with the articular surface of lower end of tibia, and this becomes more stable and less movements can occur. That's why in dorsiflexion, ankle joint is more stable rather than plantar flexion, where the narrower posterior side of the trochlear surface allows more movement.
What are you looking at now? Can you please explain the image?
This is the dorsal surface of foot.
Okay, which foot, please? Dorsal surface of the
right this foot. Is right foot.
Okay, right. If you can please identify structure 7.
7 is the extensor hallucis longus.
Very good. 17, please.
17 is tibialis anterior.
Yes, good. Now, if you can identify number 6.
Number 6, extensor hallucis brevis.
Very good. Okay, one more. Yes. 5, I want you to identify. This is here 5.
5 is the extensor digitorum longus of third toe.
Yes. Yes. 6, 7, and 5. Yes, and 17. These are the most important. If you can identify 12 as well. Here is
12 is peroneus tertius.
Yes. Yes, these are the ones. Okay, Bell is also gone. Good. Thank you.